Hello, everyone. My name is Mike. I'm a physical therapist and your host of the Health Me podcast. Thanks for tuning in, and remember to leave a like and subscribe so you don't miss any updates. Welcome back, everyone, to the Health Me podcast. We are back this week for an episode discussing the wonderful yet challenging world of nursing. Our next guest has had an interesting ride, having worked closely with nurses during COVID, has had advanced his career in nurse staffing, and also shares a little bit about his own personal story within the healthcare system. He currently sits as the VP of Business Development at an emerging healthcare staffing company called SnapNurse. But before we get into SnapNurse, as a prelude to the podcast today, it's important to know the world of nursing is changing rapidly. Since COVID, many nurses have felt burnt out, overworked, and underappreciated. Some of these problems existed before the pandemic, however, it has certainly exacerbated with recent events. As a result, there have been frequent staffing issues with nurses not wanting to work, and protests have also taken place in certain parts of the country to try and fix some of these problems. Nonetheless, today is not to discuss these details, but rather provide an opportunity for us to discuss many of the issues nurses dealt with during the pandemic as firsthand experience from our guest. In addition, we will also learn about an amazing company looking to help aid in staffing issues all across the United States. Once again, the company is called SnapNurse, and their sole mission is to connect nurses to various healthcare settings to find the right job and fulfill the need of healthcare staffing. They not only help nurses, but are expanding to aid other healthcare providers as well to help them find the right career. This episode is important from a provider standpoint to understand the many options you have as a healthcare provider and how companies like SnapNurse can be a great way to avoid burnout in healthcare. For those listening who may have been a patient before or have a very personal relationship with someone in nursing, it'll be great to hear about how the field of nursing is changing and how companies like these are doing their best to help resolve some of these issues we are seeing. As always, links to everything will be in the show notes, and stick to the end for the Health Me to Health You portion of the podcast. Here's my conversation with Duston Harper. Well, Dustin, thanks so much for coming on the podcast today. It's really excited to get you on here and discuss everything with what you're doing with nursing, but also just more broadly, marketing, nursing, and your experience with healthcare.
Awesome. Glad to be here. Definitely a big fan of your podcast and look forward to talking today.
Well, we actually met over LinkedIn, which has been, I found a great way to connect with people. And I don't know if you found it that similar where you're connecting with providers over LinkedIn. I guess maybe just speak to your experience. Have you been having good luck with connecting with other healthcare providers on LinkedIn?
Yeah, it's actually the last year I've really focused on LinkedIn. I worked with somebody else who has had a ton of experience with it, and I've really put a priority on LinkedIn the last year with people like yourself, but also with potential customers or providers. And, it's definitely a grind. You got to be consistent. You got to be doing stuff daily or at least a few times a week, but it really can't pay off. And I feel like in general, there's a lot more healthcare providers, people like yourself, people in medical device, getting more and more active on LinkedIn. So it's a great way to kind of make that network effect, kind of build your brand up, engage with customers in a different way, versus hounding people with cold calls and whatnot. Maybe you like and comment on the posts, and I feel like it's a much more kind of engaging way to get a hold of people.
Yeah, certainly. And I've seen a couple of people say they're getting spam still, but you're going to get that in no matter where you go. But hopefully it continues to be a great way for healthcare providers to continue networking and grow a great network. And you've had an interesting ride into healthcare, both as a patient, but also as somebody who works within healthcare now. I guess I've asked you this before, but I wanted to know, how's your pec tear going? Because you not only have you had one pec tear, but you've managed to have two. But maybe just speak to, so everyone can kind of get filled in, your experience with healthcare and how you managed to tear your pec twice.
Yeah, I'm one of the unlucky few. I don't know what the percent of people that have torn their pec major twice, but it can't be very many. So you don't want to be in that club. So definitely do not tear your pec. But yeah, going back like 10 years ago or so, I was doing CrossFit. I was living out in Nevada at the time, actually, and just kind of going a little bit too hard in CrossFit. You probably heard that story before, and tore my pec. And that time I definitely knew something bad happened right away, and had to get surgery pretty soon after. And it was I think a grade 4 tear. So you would think I would have learned my lesson. It definitely was a long recovery, but then about, let's say 10 years later, I started doing a little more aggressive workouts, not to that extent, but more like push-ups and things of that nature. And I think I wasn't listening to my body. I was working out too many days in a row, like not resting as much as I should have. And it wasn't like one traumatic event the second time, but it just started hurting and I didn't stop when it was hurting. And then over the next like week or two, it just started getting worse and worse. And I could feel that there was something definitely off. So unfortunately, toward the same one again.
Mm.
So here I am about 7 weeks out of surgery and I feel much better. I actually saw my doctor a few days ago and everything's looking good so far. I just got to be really strict with PT, stretching, and just kind of going through the process. I think the first time around I was a lot younger, so I didn't have to maybe do as much of that stuff. Or in my head, I didn't think I had to. This time around, I'm definitely gonna take care of myself, and then probably not as aggressive of workouts moving forward. Although I do like to be very active and healthy, I'll just have to kind of pivot a little bit because I do not want to tear it for a third time. That's for sure.
Definitely not. Well, at least you still have your legs and you can still use all the muscles down there. So hopefully you can get on the bike or get some running in, at least when your pec starts to feel a little bit better. Have you found that you've had to warm up a little bit more than usual? Or I guess like what have you experienced? I've never had the opportunity to work with a pec chair. I guess what's it been like? Maybe after the first time, did you notice yet your warm up became more important to you early on?
Yeah, I think it built up over time. I realized that like stuff like stretching and yoga, things of that nature could be a really awesome workout. And I think just the power of like stretching before and after working out, like later in life, I kind of realized that. And I'll be certainly way more focused on that moving forward. And then I'll have to be more creative, right? Like, so doing stuff like Peloton, incline walking the next couple months. So, but even stuff like that, I found like you can still get a pretty good workout. You just might have to spend more time at the gym or whatever you're doing. So I'll try to stretch really good before and after. I'll do like incline walking, Peloton. So just have to kind of think outside the box a little bit more, and then have like a good PT locally. I have a guy that has been great so far, and just kind of staying consistent with that. And gives me a lot of things I can do at home, like during the day when I have Zoom calls or whatever.
One last question to this, and then we can kind of move on. But I'm curious, can you use the other side? Can you like press with the other side and maybe do like dumbbell pressing or like rows, or how does that work?
Yeah, I can. Like, I'm starting to do some lighter weight stuff, and I'll have like a little bit heavier weight on the left side. I don't want to like make it completely disproportionate from like the size of my arm to the other side, but I will put it a little bit higher weight. But I'm like still like 10 pounds or less, so it's not like I want to go show off in the weight room right now. It's more of a at the PT or my gym at my condo.
Right. Just making sure that you don't completely lose all the muscle on one side and be Popeye on the other side.
Yeah, that's the first time around. I think I got like that frozen shoulder or stiff shoulder thing where I
Ooh.
wasn't moving it as much, and that's like not good. Where like your whole because it's connected to everything. So if you're not moving your traps and your triceps and your biceps, like that whole shoulder can get frozen. So I'm trying to avoid that this time. So far, so good. But the first time that was not fun when that happened.
Well, now that you're in the healthcare space, you kind of get to talk to different providers and you're also in marketing, but I will maybe speak to what was it like for you going through the whole process of, being a patient and being injured and going to a surgeon and, did you have this very complex experience with it? Did you feel like it was an easy case for you? I guess maybe speak to your experience with the healthcare system from a patient perspective.
Yeah, it's a great question. I think, what I was doing previously, I was in medical device and I was in the hospitals all the time during like pandemic specifically. And there was a lot of ups and downs and a lot of challenges, as I'm sure everyone's well aware. So I might have had a little bit of a going into it. I didn't set the bar too high just based off some of the stuff I've seen over the last few years. And that's nobody's fault. It was just a chaotic time for healthcare. But honestly, I was pleasantly surprised with the experience from kind of start to finish. So I mean, whether it be those first initial appointments with the surgeon and their PAs and their team, or when I had the surgery, dealing with all the different nursing and all the different workflows, it was actually very seamless from start to finish as far as the experience and how they were treating the patient. So a great local system and a great surgeon. So I was impressed with that, and I think it was a lot more positive environment than I probably would have expected. As far as maybe opportunities for improvement, I will say providers talking to each other. So let's say, I go to somewhere to get an MRI, I go to PT, I go to the surgeon, like, it feels like you have to fill out the same exact stuff, like literally 15 times. And then as far as like insurance and when you're paying, it can be very confusing, I think, to the patient because oh, you don't owe anything today. And then you get a bill like 6 weeks later and you're like, can't even remember what that was for. So that's like just some of providers not talking to each other, which is a super complex subject. But other than that, I was happy with being in the hospital at the authorized surgery center, and impressed with like all the nursing workflows and all the different people involved to kind of make that surgery happen. It was about a 2 hour surgery, so it's fairly complex. And I think the fact that it was the second time, it was definitely not the easiest one. So.
Well, having gone through your experience working in nursing and also in hospitals beforehand probably made it really easy. And certainly, even as a physical therapist, I've heard this time and time again where we need to be talking more to each other. And of course, the goal of this podcast is for providers to continue talking to each other and build a network and community around that. But certainly a different conversation than where we're at today. But maybe you could speak to a little bit about you working in hospitals around COVID time. That had to be quite a stressful time. And what was your role and what was your experience working during that period of stress and high anxiety, and also working with nurses?
Yeah, so I changed industries in the middle of 2019. I had been in power tools for a long time and had a great kind of run there. And then one of my friends actually worked for Stryker, and one thing led to another, and I was able to get a role at Stryker. But it was the middle of 2019, so interesting timing, right? So just as I started to get up and running, it takes a long time in healthcare, just how complex it is. I was starting to feel good, and then February, March 2020, like the whole world changed forever. It was the biggest pandemic in 100 years, and I was not in an area that was accelerated by that. Think of like PPE or vaccines might have accelerated it, but a lot of the other areas of medical device and healthcare were completely shut down. So it was not hearing back from anybody for months as far as customers, because they were so focused on the safety of their nurses, safety of the patients, and all that. So it was kind of like, what decision did I make? There's a lot of like thinking back of like why did I do this type thing. But eventually I kind of focused on kind of the silver lining, because it did make you be a lot more creative. It made you really think about, why are you doing this? To help the patient, help the nurses. So it ended up being kind of a blessing in disguise. It was not an easy few months, and honestly, still there's a lot of remnants of what happened a couple years ago that are still challenging for medical device. The cool thing is I was in like an area that was focused on nursing, so it was a lot of kind of everyday products that would help prevent nurses from getting injured with like safe patient handling, or help patients get or not get as many infections like pneumonia. So it was very nurse driven, which was kind of unique. A lot of times you think of medical device like calling on surgeons or being in cases, which is definitely true, but I was in a little bit different capacity. So I got really exposed to all the nursing levels, whether it be a chief nursing officer to a nurse director to an everyday nurse or tech that's working on the unit in 12-hour shifts. So I was kind of there at the ground level, seeing all that for the last few years. And it really kind of gave me a different perspective of like what nursing's all about, and some of the great things that they do, and then some of the struggles that have kind of came out over the last couple of years with nursing.
What would you say some of those struggles are? I know that, I mean, you were working with so many of them, and you were basically a nurse, and not a nurse like practicing, but basically seeing exactly what they're seeing, and, going through the same struggles of, physical labor and the hours that they work. I guess, like, what were some of the struggles that you saw that were maybe top of mind after working with them?
Yeah, so a couple things you mentioned. I think just those 12-hour shifts are long shifts, right? You're on your feet the entire time. If you're like in an ICU setting, I mean, it's super stressful environment. Like every minute there's something going on. So I think it's a very high stress environment. 12 hours is a long time to be in a hospital in a unit doing that. So that's one thing that stood out. The other thing is, in the past, I think there hasn't been as much flexibility with the scheduling for nursing. So a lot of times they might work like 3 days in a row, 12-hour shifts, and some of them may like that type of schedule, but that can kind of wear you out for sure. And then with COVID happening, I mean, all the kind of safety and PPE was a very chaotic time as far as what are the protocols. They were changing every week. Like, do we have access to PPE? And on those COVID units, like all the stuff that they would have to wear. I mean, it was literally like wearing an N95 even for like an hour or two was tough for me. But I can only imagine having to do that for a full 12-hour shift, plus all the other layers that they would have to put on. So those were some of the things that stood out. And then I think even prior to COVID, I think there was some maybe some burnout going on, some morale challenges just in healthcare, and COVID just kind of put everything to the forefront and escalated it pretty substantially. But those are some of the things I saw. There's a lot of positives too, as far as how I guess healthcare and nursing kind of made it through to the other side for now.
Do you feel like patients and maybe hospital systems put a lot of pressure on nurses to take a large blunt force of what was going on during COVID? I mean, I know doctors obviously were working effortlessly and tirelessly as well, but it would seem that, nurses are kind of the first line of defense when it comes to seeing patients. And did you feel like it kind of almost showed holes in the system of the hospital system that perhaps when we do have things like this, nurses shouldn't always be the one to bear the brunt force of a surge in patient care?
Yeah, I definitely think it exposed certain things, and I think overall, healthcare and hospitals are trying to do the right thing and take care of their people, and ultimately take care of the patients. But it was very chaotic for a time. So you think about ratios in the hospitals as far as like how many patients per nurse. Some of those were really challenging for a while, for sure. There was already a nurse shortage going on before that, so that put some even more pressure. So I do think there was a lot of that brunt that kind of went to the nurses. And then I think just those longer shifts and the type of PPE and stuff that was going on, it really just put a lot of pressure on the nurses. So yeah, it was definitely a challenging time to say the least.
Now, is there an idea to maybe change those shifts from like 12-hour shifts to 8-hour shifts, or is it due to the fact that because there are so little nurses, or at least maybe a dwindling number of nurses, or even nurses who are getting out of healthcare, that they're having an issue filling more time slots and different shift hours, and that's why we were seeing these 12-hour shifts on a more frequent basis?
Yeah, no, I think there's a few ways you can kind of look at it. I think first off, like the pipeline of nursing, there's got to be some kind of national type things going on as far as investing in, at the state level, as far as the pipeline of nursing. So, maybe more educators at these universities, helping the educators get paid more, and then attracting more talent, younger talent to come into the profession. So, I think if none of that gets solved over the long term, it's going to be tough to solve any of these other things short term. So, getting more people attracted to healthcare and nursing, helping out these universities and tech schools that are really trying to teach and promote that. That's going to happen to like get a long term shift. From a short term standpoint and flexibility, I do think that hospitals and healthcare systems are really trying to do that in the future. You think of like gig economy and healthcare. How is it, healthcare is a little bit behind on that compared to other industries. So I do think a lot of them are really looking at stuff like that. And there are definitely things out there that can help with the flexible shifts. So the days of a nurse working for 15, 20 years at the same hospital definitely could happen, but it's not as likely compared to what it used to be. So, maybe they don't want to stay at the same hospital. Maybe they want to work somewhere for a few months and then take a month off because it is stressful work. Or maybe they don't want to always work a 12-hour shift. So how do you kind of let them maybe work an 8-hour shift at different times and maybe not work 3 days in a row? So I think it's not going to take over everything, but I do think the hospitals certainly are going to have a certain percent of flexibility if they want to maintain their staff and kind of just go with where the demand is from the nurses. Because I think they want the flexibility because they're used to using apps like Uber, Airbnb, what have you. Like they're used to that type of flexibility. So why not do it there? And then also you got to take care of your staff too. So I think things like self-care and wellness and mental health, which you hear about, I think are big investments that the hospitals are looking to do for their nursing workforce, as well as other healthcare professionals.
Yeah, and obviously we want to make sure that this app happens and that there's better care that happens for patients, right? Like we're talking more specifically about the nurses, that they feel that they have power, that they have the ability to say when they want to work and so on. But hopefully, with these changes, that it could lead to better care for patients. They're going to be more alert. They're going to be more willing to come to work, or they're going to be staying at hospitals more often than not. And you kind of touched on an interesting topic in regards to just like hospitals and like nurses wanting to rotate. You're now in this area where you help nurses find new places to work, and maybe just speak to your current role with SnapNurse, and how you've been helping nurses find new locations to work.
Yeah, that's awesome. I appreciate that. Yeah, it's SnapNurse. It's actually a company out of Atlanta. So it was founded in 2017. Both of the founders have a clinical background, so they've worked at hospitals in different capacities. And years ago, they kind of saw sort of this archaic process sometimes of like trying to find either temporary staff or full-time staff, and people still faxing resumes and things of that nature. So that kind of sparked the idea of like, how do you kind of bring that kind of gig economy to healthcare? So how do you get the right nurse, the right place, the right time, the right specialty, and sort of bring hospitals and nurses together really fast, sort of like an Airbnb type marketplace. So that's when they came up with SnapNurse, and really it's focused first on the nurses, but also on the hospital. So from a nurse standpoint, it's giving them the flexibility. So a nurse in Atlanta could go on the website and see available positions throughout Atlanta or whatever city they're in. So they can kind of pick shifts as they want, or if they want something longer term, they can do stuff longer term, whether it be like a 12-week contract or something of that nature. Also, SnapNurse is kind of has over 350,000 people on the platform, clinicians and non-clinical. So I think it's kind of built up its own like kind of culture in its own, and people really enjoy it. And they talk, different nurses on the program talk to each other, and I think that kind of keeps them happy, keeps them morale high. And they also have a option to get paid same day. So a big reason why nurses like it is like if they go pick up a PRN shift, maybe to help out another hospital, they have an option to get paid same day, which I think a lot of people are still live paycheck to paycheck. So that's something cool that hey, if they go work a 12-hour shift to help out another hospital, they're going to be in a pretty good mood because they can get paid the same day. So those are a few things of how it helps nurses. As far as hospitals, similar stuff is it's going to help them with the flexibility, right? If they can be more flexible for their staff and maybe use some short-term labor, that's going to keep their own staff less burnout and not having to work extra shifts. So that's a good thing for morale overall, and then it should be able to save them time and money. As far as not a lot of nurse managers and nurse directors are spending a lot of time, like half of their time, trying to figure out scheduling and finding nurses who call out. So this can help kind of connect the dots, and also it could save money too potentially. If you're not doing if an internal nurse isn't working an extra shift, that's less overtime type pay. So we try to look at it from both standpoints, as how can we help the nurses and hospitals, but that's sort of what we're focused on.
Well, you mentioned something earlier. You said a gig economy, and you mentioned it twice. Maybe just describe what you mean by that, for if we don't understand what that is, or like how it's implemented, or like how is this arising in healthcare and hospital systems?
Yeah, so you think of like Uber or Airbnb. It's you can go to a city and you can see how many houses might be available, and then you can quickly connect with that. It's similar type of concept in a different way. It's like uh, for example, I mentioned how many nurses are on the platform, so you can kind of see in Atlanta or another city how many nurses are available in the specialty that you need. So it's really trying to connect the right nurse with the right place, the right specialty at the right time, and then you can customize it, right? So you can put oncology, you can put 7 years of experience, you can put Epic or Cerner trained depending on what you need, and then you can really kind of dial it down to like find somebody that's already pretty trained up and potentially can help you out. So I think that's sort of it's a buzzword that you hear, gig economy, but if you think of it from that standpoint, that's sort of what we're trying to do in healthcare. And that's not going to take over everything by any means, but if it can help the hospitals be more flexible and help the nurses, then hopefully it's a win-win for everybody.
Well, another aspect that I've heard or seen also on LinkedIn is just the idea of like AI within healthcare. And one solution that they believe AI will be easily implemented within healthcare will be at the administrative level. And have you guys perhaps thought of or are planning to use AI to help maybe schedule nurses appropriately, or is this still something that you guys do from a person standpoint, in which you try to connect them with hospital systems and so on?
Yeah, there's a longer term play for sure, where we could partner with hospitals potentially on how to make all their scheduling a little more seamless and less time. So we're definitely looking at things like that. As far as the exact AI type stuff, that probably wouldn't be my expertise, but I do hear from other nursing leaders that they can look at census, right? So there's census and demand is like a big challenge, and I do know there's some AI platforms out there where a week from now you can see what is that census looking like. Is it supposed to be 92% the capacity, and then it will actually go like I think even further out to 30 days. I know there's some places and companies that are trying to help hospitals like plan that demand, which probably goes hand in hand with what we're talking about too.
Earlier in your discussion through the healthcare system, you had mentioned that you wish healthcare providers were talking to one another more often. Do you believe that with SnapNurse and maybe other gig economy related businesses, it's creating a good framework for better communication within hospital systems, or do you feel like it's making it somewhat more challenging where nurses are coming in and out, or even physicians are coming in and out of healthcare systems and making it more difficult for people to communicate with one another?
Yeah, I think some of the stuff you've seen the last 2 years, like some of the, I guess, percents of, internal versus outsourced talent, some of those ratios probably don't make sense to be that high. So I think there needs to be kind of a leveling off that's like better for everybody.
Mm.
So some of what the last couple of years I don't think is realistic moving forward, and it needs to kind of stabilize a lot more. And I think myself as well as where I'm at, we want to help do that the right way. So I don't think um, you'll see the same type of stuff hopefully the last couple of years as you will in the future. As far as talking to each other, yeah, it's a great question because I mean we can help kind of make the credentialing process a little more seamless, which is always a pain point for nursing. So you would think that that might help with some other communications. But I've also worked with a lot of hospitals, a lot of hospital systems, and I mean each of these big hospital systems have like 25,000 plus employees. There's a lot of silos. Like it's hard for even hospitals within a system to talk to each other
Hmm.
internally. So I don't know if I have a perfect crystal ball answer for that, but I do know that we are able to help a lot with credentialing and making that more seamless, which is always a pain point. So, I think it's something that people are definitely looking at, but I feel like that's a beastly project in itself, just because I've worked with like implementations with big systems, and it's hard just even internally for people to be talking to each other. So I can only imagine. But I think you need technology to do that, right? Otherwise, if it's a manual, it's going to be the same as it's always been.
Well, at the very least, I think SnapNurse is providing this community of nurses who can rely on one another, right? Like they can reach out to one another and be like, "Hey, this hospital did well for me. These guys are great," or this hospital really doesn't value my, opinion, and hopefully will increase the standard of the hospitals to be like, "Hey, well, if you're not gonna, do well by our nurses, then we're not gonna go and work there." And has there been a secondary benefit of developing SnapNurse where you have built this community of nurses who have been able to communicate with one another and tell each other, like this is a good place to go, and move forward with a contract that they were kind of maybe iffy on?
Yeah, I think so. I think they definitely talk to each other. They they're gonna probably gravitate towards the places that have treated them better, and all that. And that goes to same thing for those hospitals and internal nurses. Is people talk, right? The nurses definitely talk. It's a big community, and I think during the pandemic, the nurses kind of realized, they're the biggest workforce in healthcare, right? 4 million roughly plus, and they do have a lot of power together. So I do think that they're a lot more proactive with these conversations, and I think hospitals definitely understand that. Again, trying to do the right thing. It's just there's a lot of moving part, but yeah, I mean, they certainly talk to each other in SnapNurse, and hopefully having pretty positive experiences overall at the hospital.
And having worked with, so many nurses and now with Snap Nurse, have you seen an uptick in perhaps the number of nurses who are joining the platform and trying to, find new places to work? Have you seen an uptick in this, or have you seen a down surge? I guess, have you seen more and more nurses trying to find new places to work and using Snap Nurse as a tool to do PRN work or so on? Or is there a difference between the two?
Yeah, I mean, I think initially, uh, probably at the beginning of the pandemic, there was a pretty significant rise for obvious reasons based off what was going on. But even since then, we've consistently had a pretty aggressive amount joining the platform every month. So we have a really good kind of run rate of that, which is good because that means we have a lot more options for the hospital. So what that's saying to me, at least from my standpoint, is that the flexibility side of it, nurses want that. They got a good kind of representation of that during the pandemic. Is what would travel nursing look like, or what would PRN work look like. So I think moving forward, no matter what happens with the environment, they're going to want that flexibility. So again, it goes back to that's what they're saying and that's what they want. So how do you kind of work with places like SnapNurse or internally at a hospital, figure out how to be more flexible? Because I think that's just the path that everyone's going on, and I don't think there's any way to reverse that just based off what I've seen and people I talk to.
And have you found a younger population of nurses coming on the platform, or do you often find that it's the more experienced nurses who are trying to find new careers or change to different locations?
Yeah, I don't have the exact specifics on that, but I would gravitate towards, I think, typically it's probably more younger doing it, but I will say that there's a wide variety too. But you got to factor in like once if you have a family and kids, it's a little harder to go on long-term contracts because you're away from home. So yeah, I think it's a good mix, but I think it certainly probably gravitates a little bit towards younger, just because they're used to that kind of the way things work with the stuff we talked about earlier, like Airbnb or Uber, what have you.
Yeah, and I know for myself, we always had this lecture in physical therapy school where it was we had these travel physical therapists come in and they describe what they're doing, and there's always that incentive for money. And I've certainly seen a lot more younger therapists hopping on to do travel, and many loving it. Honestly, like they have the ability to go into different locations, see and work with different therapists, and I feel like sometimes therapists can feel that they are trapped where they're at and they're only learning for so much. And it's a great opportunity for therapists, or in this instance nurses, to go out and learn from other providers and learn and build other teams, and see the country as well. And overall, I think it's been great for the profession of healthcare, but also I'm assuming for nurses. Have you seen from this time of building a network with SnapNurse, and after COVID, that healthcare system has put so much stress on these frontline workers, do you feel that the role of nurse has changed?
Yeah, I do. I think there's a lot of kind of things that were showcased during COVID that were probably like underlying issues prior, but they kind of got taken to the forefront. I mean, the reality is it's the largest workforce out there. It's always ranked as the most trusted workforce every single year. It's like by far the number one there. They're in front of the patients the most out of anybody. I think, I don't know what the stat is, but well over half the time a patient's at a hospital, like most of the time they're in front of the nurse. So it has a huge impact on patient experience and ratings and all that stuff. So I think there's definitely going to be a shift. Like a lot of stuff that was happening before is just not sustainable. So, how do you use technology on the nursing units as far as like, maybe automating some things that were more redundant, kind of frees them up for other things, or like team-based care versus your traditional kind of staffing ratios. You mentioned AI. How does that kind of integrate with stuff? Things like SnapNurse to help it, them be more flexible and automate some things. So I definitely think the role is changing, but like everything in healthcare, it takes some time. So I think people are really trying to push for that change, because if it doesn't change, it's going to continue to probably struggle as far as the shortage numbers and people getting into nursing. So hopefully, people like yourself, me, and a lot of people I know are continuing to be there. Like, we need some people that are willing to kind of ruffle some feathers and make some things happen, and stay positive with that. And it seems like that's the direction it's going. But it's also healthcare, and usually stuff takes a long time to come to fruition. So I guess we'll stay tuned on how it goes.
Well, it seems like a lot of things are happening very quickly other than healthcare. How has it been to keep up with everything that's happening around us and then trying to implement that within healthcare, from your perspective?
Yeah, it was, when I first started before SnapNurse and I was in med device, I mean, I was a little like kind of hitting a brick wall with like the process within a hospital to get change done. So super complex. You got clinical side, you got business side, you got, anything you want to get done. There's 20 plus people involved for a big hospital. So it was, uh, it was tough. But I will say when the pandemic happened and there was stuff that had to get done, whether it be supplies like for patients, or some type of PPE or safety. Like when stuff really had to happen, I did see the red tape kind of go away, and things were happening in days or weeks. That things that would probably happen in months or years before. So I do think it's possible, but I guess the key is to not let everything revert back to what it was like before. And how do you continue to get that change a little bit faster? Because I think it was proven that it is possible to do that in certain areas. So how do you kind of get everybody on that same page, and get those decision makers to keep moving forward? Plus, there's a ton of competing priorities, right? It's all about priorities and what is most important. I think staffing is definitely up there at the very top. Safety of nurses, safety of patients. So those type of things will probably be the most likely to get disrupted, because they are like top issues and problems.
And would you say those are the largest, issues that you run into, or the challenges, working in sales and healthcare at the same time, where you're, trying to manage the big system of healthcare and how slow things are running?
Yeah, I mean that was one of the things like when I was doing medical device, like I couldn't even talk about some of the things that I was trying to introduce that could bring a positive change to nurses or patients because there was so much kind of chaos with staffing and burnout and morale. So I think yeah, I mean, staffing for sure is up there at the very top. I think the self care, morale, reducing burnout. That's not just nursing. That's just like healthcare in general. That's a big topic. And then I think the stuff you mentioned, with AI, some of these different technologies, like how do you continue to do that? So those are just a few that pop off at the top of my head, but I'm sure there's a lot more that people are looking into.
Well, it seems like you had an experience with COVID, shared experience with these nurses during COVID. Have you learned or adopted any new techniques to keep yourself sane within healthcare, and having gone through this very stressful period of what everyone experienced as a global pandemic?
Yeah, it's a great question. I did actually. So there were some times during the pandemic that it was hard to stay positive myself. Just quite frankly, I mean, you're going to a hospital. It's going to be potentially a challenging environment just because there's a lot of uh, different things going on with ratios and people moving to different units and just the type of patients and how like high acuity they were. So I knew going into hospitals, like physically going into hospitals, there's going to be some tough days, and like how do I be a positive distraction, be a positive influence on the nurses for that day that I'm in there, whether it be doing education or showing them a new product, whatever it may be. So yeah, I really try to look at it like how am I helping the nurse, how am I helping the patient, and you have to remind yourself daily of that. And hey, maybe they see a salesperson and it kind of brightens their day for that shift. You never know with whatever you're doing. So I try to like literally remind myself daily on that. I still do. I also started doing a morning routine. Somebody I worked with for kind of like a variety of things really wanted to talk about like morning routines and how do you focus on yourself more. And I think a lot of people looked into that type of stuff during the pandemic, but I do a morning routine every day for about 30 minutes, and it kind of just starts my day off the right way, staying positive. I listen to a motivational video. I do some empowering statements, some things like that. I look at things I'm grateful for, and then a couple other things, and that's really helped me too. So I try to be at least 6 out of 7 days a week do that morning routine, and that really helps me in healthcare and what I do now, what I did previously.
And obviously, mental health continues to be a large thing that we all need to confront, whether it's something small with managing a small amount of anxiety, and to people who are completely debilitated by anxiety and depression. And we've also mentioned burnout within healthcare. Do you believe that perhaps to help solve some of this, we need to be having more conversations about how nurses, doctors, therapist, anybody, can better deal with some of the stressors that are associated with healthcare as we continue to try to improve it and make it better for everybody?
Yeah, I definitely do, and I do see some of that too. Like I think some of your more proactive hospitals or have some cool things that they're doing to try to help nurses, physicians, and other workers. So I do think it's a big topic for sure. As far as like break rooms, like how can you kind of innovate the break rooms? Like have you think of like tech, right? Like Google or Facebook, like they have like massage chairs and all this stuff. But like, how do you do some of that at hospitals, or even just basic stuff of like paying for parking and having like maybe lunch and things like that provided. Like, so I do think there's a lot of things like that people are looking at, and yeah, it's got to be up there at the very top because I think it doesn't matter what profession you're in healthcare the last few years, like everybody felt a little bit of that burnout. The reality is, if you don't take care of yourself, if you don't take care of your employees, like they're not going to be able to take care of the patient. So it's got to be at the very top. And hopefully, people, I feel like that was the silver lining of the pandemic because I wasn't necessarily like that before either. But now I'm like way more focused on making sure I'm right because then I can't really perform at other stuff if I'm not right. So hopefully that's continuing to be uh, taking effect at the hospitals with all the different people working there.
Yeah, I've been doing the same thing, just as I'm a healthcare provider myself, and trying to make sure that I'm 100% focused, and making sure that I feel that I'm decompressing from the day, and being able to bring the best version of myself to my patients. And part of that for me has just been a little bit of meditation. But certainly it definitely helps to have, change locations and move from different places. And I started a physical therapy in Buffalo. And then I moved to San Jose, California. And that was probably one of the biggest things that helped me, and the ability to just feel like not feeling stuck. Right. And, with healthcare, you can definitely feel stuck. And, building off this idea, say there's a nurse out there who they feel stuck. They're in the middle of Montana, or maybe they're in like Miami, Florida or something like that. And they need to get out of the situation that they're in, the hospital that they're in. How does one, go about trying to change or find a new place to work with SnapNurse? And maybe just give, if there are nurses listening, some easy steps that they can follow, so that way they can take the right action towards getting out of their feeling or sensation of stuck.
Yeah, so as far as like nurses, if they want to get on the platform, if you just go to snapnurse.com, so snapnurse.com, there'll be a section for nurses, and you can quickly fill out your information. And then based off whatever specialty or credentials that you need, we have a team of people that will reach out to them very quickly. So, I mean, within, you know, uh, probably less than a day, we could get some things going, depending on what they're trying to do. So that should be pretty quick and easy and seamless. Just go to snapnurse.com. Otherwise, you can also hit me up on LinkedIn and shoot me a message. So Duston Harper, it's Duston Harper. You can always message me, and I'm more than happy to walk them through it or connect them with the right person. And then I'd say just in general, like with healthcare, nurses, like I think change is good sometimes, and a lot of times you get stuck in your comfort zone, kind of the status quo, and like you just keep doing the same thing, and it's not really kind of motivating you anymore, or you're kind of in a rut. So I think change is good sometimes. So you obviously need to weigh the pros and cons of like moving to a new role. But I can think of the times that I've changed careers and took some risks. And that's the time where like you really kind of break out, and like some bigger things happen. So I'm all about positive change, and kind of getting out of your comfort zone. And I recommend, nurses or really anybody in healthcare in general to not be afraid to do that. And hopefully that's another thing with, you see this great resignation, that people are a lot more open to maybe trying new things, and why not, right? You don't want to have regrets later on, so why not do some of that stuff when you can?
Yeah, and perhaps, before you're starting a family, and, or if you are just feeling completely burnt out from healthcare in general, and you've been doing it for quite some time, this might be an opportunity for you to fall back in love with what you started with, 10, 20 years ago, right? Like I've heard of many nurses who even they've not retired, but maybe they had their kids, they're all grown up and they're still a nurse, so they're still a PT, and they're like, well, I'm going to go do travel now. And I think it's also a great opportunity for, just to change things up, and maybe fall into a new area, or fall into a new, hospital that allows for, growth, and make you feel that you are part of a great system. Now, for SnapNurse, does it place strictly or solely within hospitals, or is also nursing homes or like home health? I guess, how does that work?
Yeah, it's a great question. No, I mean, nurses are the core, hospitals for sure, but we do a lot of other stuff. So surgery centers, we do post acute, in places like that. We are looking pretty seriously into home healthcare, and kind of get in that avenue. So I'd say nurses are the core, hospitals are majority, but we do a lot of stuff, at surgery centers, different clinics. Post acute is a big one. Nursing homes, and then we are looking pretty aggressively into home health care and how we can help there. We also do, techs, we do LPNs, we do paramedics, we do, probably some stuff starting to get in airspace too. So the cool thing is that we can kind of customize it for our customers, or that hospital, depending on what they're looking for. So we have a lot of things outside of nurses too that we can help with, which is cool.
What kind of benefits do like traveling nurses, so to speak, get? Are you getting, like, maybe there's a nurse listening to this and they're like, well, can I get benefits working for you guys? Or are you working for the hospital that you travel with? Or guess, how does that work for someone who doesn't really understand?
Yeah, it's going to vary depending on which specialty we just talked about, but I'd say in general, uh, typically they're not going to have the full benefits that like somebody working full time at a hospital was. So that's probably the biggest difference, and that's the downside, right? So I mean, people talk about, getting to travel and all that stuff paid for, and probably a little bit higher, pay rates. But then if you're not getting the benefits, if you do the math on that, it's maybe not as exciting to some people as it is. Plus, you're away from your family, things of that nature. So I'd say in general, I don't most probably don't get the full benefits that you would if you're working at a hospital, but the pay rates might be a little bit higher because you have to travel. There's a lot of stuff that gets factored into there. Outside that, it does kind of vary depending on specialty or which part of the country and things of that nature.
Yeah, and certainly if you're getting paid more, maybe you can pay for better healthcare insurance or, whatever you want to do at that point. But it's certainly something that, continue to address. I guess having worked in, with nurses so closely, we've worked with COVID and now you're starting this new journey with SnapNurse. I guess what are you most excited for as your new role at SnapNurse? And I guess like what are you most excited for in the future of healthcare?
Yeah, so I mean, the last few years were a great experience when I was in medical device, and I that's really kind of how I got passionate about trying to help nursing, and I definitely was in a great way, and appreciate the experience I had before. I think like going into SnapNurse, I feel like just the technology and the way they can connect hospitals and nurses quickly, I feel like I can make a much bigger impact, maybe where I'm at here in Georgia, but also across the country potentially, connecting with people like yourself. So I feel like in a bigger way, I can hopefully really help both nurses and hospitals, surgery centers, like try to figure out some of this flexibility in staffing. Definitely not going to be perfect by any means, but I'm excited about just the opportunity to kind of get the SnapNurse name out there and also hopefully help a lot of people in healthcare. So that's sort of what I'm looking forward to, and I think um, that's really one of the biggest challenges in healthcare. So it's like that's kind of where I want to be. Like, how do I help solve one of the biggest problems, be a positive influence, and partner with people like yourself and hospitals to kind of make it happen.
It's all about people helping people, and that's certainly what we're doing today, hopefully with people listening to this podcast, but also your role and my role. And it's just creating this framework where we need to help everyone needs to help somebody, and it's like almost a responsibility. And I think in a world where we are further detached, or can make it feel like we're further detached from one another, we need to make sure that we are also doing our part and helping somebody else in whatever way humanly possible, whether it's at work or whether it's um, at home, or however. We need to be helping other people, and it's certainly something that I try to live by, and hopefully, and it seems like you do the same. And the future is certainly bright, and I want to thank you for coming on and sharing so much of what you've experienced over the past several years, as well as share with us how SnapNurse is looking to change the nursing world for the better. We're winding down right towards the end, and like everybody else in every other interview, I'm going to ask you the same three questions I ask everybody else, and this is the health me to health you portion of the podcast. So first question, we kind of touched on this a little bit, but I'm interested to know, if you had the attention of everyone in the world for 30 seconds, what would you say?
Yeah, a few things we touched on. I think really focusing on yourself. Like, not even I used to be. I would always prioritize work stuff, and I was usually pretty good at work stuff, whether it be sales or what have you. But there's just there's a point of like diminishing returns, right? If you're working too much, you're working too hard, you're just going to burn out. I think the good thing about COVID is that it really opened up my eyes of like not just not working as much, but like really focusing on myself, whether it be like my workout routine or my health, my morning routine, like doing a little bit yoga, meditating, like you mentioned. So that was probably one of the biggest takeaways that I had was the self care, focusing on myself, and how that I actually work less hours, but I'm way more productive and I get way more done just based off that change. And it's a habit, it's a routine. It's not like it happened overnight, and I'm still not perfect, but that was definitely a big thing. The other thing too is I think open up a lot of people's eyes is like trying to limit regrets and um, if I had this opportunity with SnapNurse and it seemed like the stars aligned and perfect opportunity, and that's a big reason why I did it. And I feel like you don't want to have regrets, right? So obviously I can't be perfect on that, but like limiting those regrets. And if you have a chance to do something that you think is the right move in your gut, like I just recommend people do that while they can, because it gets tougher, once you have family and kids and as you get older. So if you have a chance to do that, do it, or whatever age you are, do it too, because you might as well, just to kind of get yourself out there and change things up.
Yeah, and from what I've seen, it seems like you guys got a great team over at SnapNurse, and you guys are a pretty great tight knit community over there. Am I right?
Yeah, it's been great. I mean, it's only been a few weeks, but we've already had a bunch of stuff in person, and you've probably seen some of my LinkedIn stuff. And yeah, it's a great culture. The founders are right here in Atlanta, so I'm able to kind of talk with them and kind of see the future. And yeah, it's kind of a very innovative, upbeat, positive, kind of vibrant environment. So I'm excited about it for sure.
Love it. Second question. What book do you recommend, whether a book you're reading now or in the past?
Yeah, so one I read recently is called Mindset. It's by Carol Dweck, Dweck, and it's all about kind of that positive mindset that we talked about a little bit, and just trying to kind of, I think that really helps with people in healthcare. So I recommend that one.
And I'll put everything in the show notes below as well. If you're looking for it, I'll put the Amazon link so you can go right to the book and buy it immediately. Last question. Where can people learn more about what we talked about today or learn from you? We already mentioned your LinkedIn, but are there other locations that people can access you or ask you questions?
Yeah, definitely LinkedIn. And that's the best way to get a hold of me. If you want to email me, it's just my name, Duston.Harper@SnapNurse.com. And then you can also go to SnapNurse.com. And there's a ton of info there if you're a nurse or a provider. But yeah, thanks, Mike. It was awesome. I really enjoyed it. Look forward to maybe catching up with you again in a year or so to see how things are shaking out.
Likewise, and you and been having more and more recurring guests on, so I'd be more than happy to do that for you. So thanks again for coming on the podcast.
Awesome, man. Take it easy. See you.
You too.